Thank you. So let me just ask Dr. Omnia Omrani to come and sit perhaps in that chair there. Thank you very much indeed, Omnia. Let me ask Alan Dangour, if you could come in the middle here, Head of Climate at the Wellcome Trust. And also Sacha Wright from Force of Nature to sit next to Alan. Thank you very much indeed. Jennifer Uchendu from SustyVibes in Nigeria, but getting here by the most tortuous and complex route today. So a special big thank you to you, Jenny. It's wonderful. Dr. Jacob Krzanowski, who is joining us from a variety of different sources, but he's an Associate Registrar for Sustainability at the Royal College of Psychiatrists, and then you get a bit of me. But for each panelist, I'm really just asking a set of questions. Who are you, and why do you believe this work is so important? And can you tell us about some of the things that you've been doing? Actually, Omnia, you're part of the team, but if you don't mind me saying so, you're also a bit of a special person because everybody's special, but you were appointed as youth envoy by the government of Egypt for the Climate COP27 in Sharm el-Sheikh. You're also a young surgeon and you enjoy your plastic surgery, but you've stopped doing that and you're now fully involved in climate work. So if you'd like to start off by giving us your views and thoughts, and I'm not going to ask any trick questions, so it's over to you, Omnia.
Okay, can you hear me?
Yeah, perfect.
Okay. First of all, yes, thank you so much, and I feel very lucky and proud to be part of Climate Cares. But if I will to reflect on why it's important to talk about climate change and mental health, as a young person myself, I believe that we are shouldering the impacts of climate change on our health, on our basic access to food, water, air, education, healthcare services. And this does not just only affect our health, but also the distress and the despair of seeing that being affected, of us being disproportionately impacted. A very recent report that was published 2 weeks ago by UNICEF showed that children and young people in 98% of countries in Africa are now living in areas of extremely high risk of climate change, which, as Emma said, does not only lead to physical injuries, but 40 times more, affecting the physical and the mental health, particularly in young people. But what was even interesting in that report, that only less than 7% of all the global climate finance that goes for climate change, less than 7% is responsive to young people. And even less than 0.7% goes to youth-led climate solutions. And I started 8 years ago working on climate change when I was a second-year medical student. And I saw, as I grew up, patients in my community being affected by climate change, whether it was acute heat stress, whether it was asthma exacerbation because of the high levels of air pollution, and how it affected their mental health and the mental health of their families because of that. And I thought, as a student who had the opportunity to go to events, that going to an event like the Climate Change Conference, like COP, and I went to my first COP 5 years ago in 2018, that I would be able to influence and urge the necessary climate action that is affecting my people. But I also felt like many young people like myself, the distress, the despair of being siloed, of being excluded, of going through a lot of tokenistic approaches when it comes to my insights and my interventions being considered as well as other young people. And this made me ask myself, what can I do as a young person to address climate change? What can I do to push countries not to backtrack on their promises that they keep doing that every single COP and every single event? But before asking that, and this is what really led me to love the work that I'm doing with Climate Cares and with the team, is that for me to answer this question, I need to think about how can we build our psychological resilience, how can we protect our mental health while working in the climate space? What can we do to be able to empower communities, both the most vulnerable, but also those who are working in this space, to cope, to adapt to the impacts of climate change, but to lead their own climate action and be their own climate agents in their societies, influencing their own governments, policy, and practice.
Omnia, thank you very much indeed. I'm going to suggest we clap each panellist if we feel like it, really. Thank you. And Alan Dangour, I've known you for a long time, and we've worked together on many issues, and together in London School of Tropical Medicine and so on. And now you've got this job at Wellcome Trust, where you're actually the head of climate change, which is a pretty important role. Would you like to explain a bit about how you've got there and what you're doing, and why you think this work that we're launching here in the centre is pretty important?
Fantastic. Thank you very much. Well, as a young person, I just had to try it out. First of all, I want to say huge congratulations for the launch of this centre. It's absolutely fantastic. It's much needed. It's a tribute to Imperial for thinking in this way, but bringing people together, as we heard from Mary. I'd also like to wish Mary a happy birthday. If this happens every year on your birthday, you're doing well. So, but I think it's a real, and what it does for me is it also. It's a very good demonstration of the sorts of work that needs to happen nowadays, the way that academia needs to change. So if I just take a step back, I was at the London School of Hygiene and Tropical Medicine for 20 years. I wrote a whole load of papers that nobody read. It was great fun doing it, but I wanted a challenge. And the challenge then came about, there was a Wellcome redesigned its strategy, and that strategy now has 4 strategic areas. Discovery science, mental health, infectious disease, and climate and health. And I was fortunate, very privileged to be appointed as the director of our strategic area on climate and health. But you're all sitting in the audience thinking, well, those things all overlap. And in fact, they overlap very strongly. And this is a very good example of that important overlap. And the work we're doing with Emma and the team on collecting climate minds is a really good example of where we're desperately trying to change the way academia works. Asking academia to stop thinking in unidisciplinary silos and to start thinking in more progressive ways, asking more important questions, questions which lead to change, rather than merely, there's nothing wrong with discovery science, there's nothing wrong with the hugely important discoveries that are made in much of academia, but actually many of the most important questions are at those borderlands, those intersections between disciplines, and that's what we have here in spades with this project, so we're really delighted to support it. What we're also trying to do is we're trying to ask academia to think transdisciplinarily, to incorporate climate change into its teaching across the board. There are almost no schools of medicine or public health that fully incorporate climate change into their thinking, and that means that the next generation of medics and public health specialists will not be trained for what they need to be trained for. And that is a significant concern, and I think we should all be worried and should be pushing new curricula and new ways of teaching. We also need to instill a sense of urgency. It is not acceptable for people, academics, to spend 5 years writing a paper, however good that paper is. And it's also not acceptable for us funders to take more than a year to fund you. So we're changing that in Wellcome. We've just had a call called the Climate Impacts Award. It was 6 months from the launch of the award to the decisions and the award letters. That's a revolution in Wellcome. It still takes 6 months, but I promise you that's a revolution, and was no mean feat. So we're really excited about that. And the final thing I'll just mention, looking at the map of people involved in the Connecting Climate Minds, is it is also clear that the totality of knowledge on all of these issues does not sit in London, Oxford, and Cambridge. And the inclusion of a greater diversity of people and countries and partners is absolutely core to answering these questions, and we at Wellcome are determined that our funding should be significantly more inclusive and bring in new partners to answer these important questions. Thank you.
Alan, thank you. You know, everybody, every one of our panellists is unique. And Alan has shown why he's unique, and Omnia showed why she's unique, but Sacha Wright is also unique. She's a force of nature, and she works for an outfit called Force of Nature, and she's probably fed up with being introduced like that. So, Sacha, tell us a bit about your thoughts about what we're up to tonight.
I'm definitely not fed up with being referred to as a force of nature. It's exciting every time. I just have to start off by saying I feel incredibly humbled to be on a panel with just such an incredible group of people, and also in a room amongst friends and colleagues who I've had the privilege of working with for the past 3 years, and some of whom I'm getting to meet in person for the first time today, like Jennifer, which is so exciting to me. I'm Sacha. I'm the head of research and impact at Force of Nature, which the elevator pitch of is a youth nonprofit mobilizing mindsets for climate action. But more straightforwardly, we are a group or a collective for young people, by young people, that exists to create a container where young people with lived experience can come forward and express those difficult emotions that come up when we think about, experience, reflect on the climate crisis and planetary emergency, and then really critically find ways to channel those into community and into collective action. I've had the privilege of working with Climate Cares over the past 3 years and seeing the progression and seeing heads start to turn as they should towards the incredible work that they're doing. And what I will say is that it has never been more pivotal for work to happen at the intersection of climate and mental health. And the reason I say that is because I've heard a lot about people who work in the mental health space putting a climate spin or a climate lens on things, or people who work in the climate space putting a mental health lens or spin on things. But really critically, this is a dedicated hub to where those two things meet, and we find that they're not actually at the middle of some Venn diagram, but they are at the root of the problems. And it is critical that we see these as a part of the same ecosystem of issues that we're facing globally. There are a lot of reasons why I think that this work is important, many of which will be spoken about by my fellow panelists and already have been, but there's 2 reasons I really want to highlight. The first is that climate and mental health, it doesn't just benefit from, it begs you to go straight to lived experience and to people's subjective experience. I come to this work as a young person, and that's how I started into this work. And one thing that I was met by that I found really interesting and that I still do is that in climate and mental health, your lived experience is your expertise. And I think that's not something that I, coming from an academic background, was used to thinking or acknowledging, but it is critical that we see the experts in climate and mental health being the people with the lived experience. And we actually change and readjust our ideas of who the experts are in this situation. It's going to ask us to redefine and reimagine systems of power that have historically excluded people like young people from having a seat at the table about decisions that are determining the outcomes of our future. So we really need to put that power back in the hands of the people who know what to do with it, because those are the ones who are both disproportionately vulnerable, but also disproportionately brilliant and knowledgeable and resilient in the face of issues like this. The second reason is because we have, for a very long time, as you mentioned, really separated things into disciplines. And what I would add to that is we've separated into disciplines human health and planetary health. And it is fundamental that we stop doing that we stop with the nature-culture dichotomy, and that we actually see that not only are those two things intertwined in their vulnerabilities, but how incredible and beautiful a world could be if we actually were custodians of both ourselves and one another, and also of our planet. And finally, why I think it's really important that we're doing this work is not related to climate and mental health, but it's because of the people who are doing it and the ways that they're doing it. I've worked in academia for 6 years, so not long compared to a room full of academics. And by about my 3rd year, I was ready to be done because I am a highly emotional and excitable person, and I was entering rooms and being asked to leave my feelings and my humanity at the door. And the fact that I'm able to sit here as a young person and invited into the room as a young person to talk about my experience and make sure that other young people are included in these conversations is critical as we move forward at the nexus of climate and mental health.
It's not enough just to connect. It's not enough just to intersect. We have to learn to combine. And somebody who's combined and who's taught me so much in the last few years is our next panelist. Jennifer Uchendu of SustyVibes, somebody who is brave and compassionate, caring and generous, and who took a lot of trouble to come here tonight. Jenny, it's just so lovely to be connected again after many years. Tell us what this means to you.
Thank you so much. It's a pleasure to be here. Took a while, but I'm here. First of all, congrats to the team. I think it's been a long time coming. I think I'm excited because this validates the importance of this work, right? So I came into this work as someone with lived experience of climate and mental health issues, not finding a space to do research, talk about it, work with people, to find partners in the global north who find the importance of this work. It's so emotional to me because, I met Emma as someone just coming out of my master's saying, I really, really want to do work on climate and mental health. And I've become this sort of global voice in this space because of the Climate Care Center, because of the opportunities, because of the path it created to say it's not enough that young people are often excluded from conversations like this, but the global south. In Nigeria last year, October 2022, over 1 million people were displaced as a result of floods. I knew some of these people. Just last 2 weeks, we had the Connecting Climate Minds Global Dialogues with young people, and someone in our room literally was showing us his room. He had water floods, literally getting to his leg, and he said, I would never find a space to discuss how this impacts my mental health without something like this. And he thanked us for the opportunity. So this is meaningful. It validates the work. I think it's not something that just excites me. It brings meaning to why this is so important, that people are suffering, but we are giving them an opportunity to not just have a voice, to contribute, literally contribute to research, to change policy, to say it's important to not just intersect climate change and mental health, but to really make it a name, a structure. This has become a thing, and I think it's really important, that idea of validation. And just as previous panelists have said, beyond validation, beyond opportunities, beyond partnership, I'm excited because this is a new way of thinking of climate adaptation. For a very long time, we've talked about CO2, net zero. Those are really exciting. But while we're at that, while we're talking about carbon emissions and all of that, my people are dying, my people are suffering, people are committing suicide. What can we do immediately to support communities at grassroots, beyond research, beyond dialogues and all? This is support, and this is literally saying that mental health conversation should be mainstream because of the different ways that it exacerbates people's lived experience. And that's why it's so exciting for me, that now research is not just something that ends in a paper for only academics to see. It can be something I take to an average woman in the village and say, well, we want to hear about your experiences, want to hear about your resilient stories because they're important. So thank you, Climate Cares. Thank you for this opportunity. It's really, really exciting for me, and I'm happy to be here.
Wow. Jenny connects people to global processes in a way like few others do, but the joy about this new centre is it's going to do a lot of that, and we're super proud that Jacob has joined us from the Royal College of Psychiatrists, and perhaps will just tell us how this looks to him from his position as Sustainability Registrar. Jacob, you have the floor now.
Thanks very much, David, and it's really, with every minute that's passed since I've been in the room, it's just been a huge honor to be able to share the space with everyone. And I think the kind of power and profundity of what's preceded me in this discussion makes it very difficult for me to think about the thoughts I had planned for you today. I think Sacha mentioned it, and I think that this idea of bringing climate change and mental health is very much about human experience. And this was just referenced by yourself, Jennifer, that I think as we move into what is a stark unknown that is going to become increasingly complicated and difficult to navigate, I think looking to people and human experience is really going to be where some of the new stories and answers lie. So I come here on the panel as a psychiatrist, so I work primarily as a clinician. My work is as a consultant addiction psychiatrist. I work in London. And in my role as a associate registrar for sustainability, what that effectively means is that I'm looking to support the profession, and that's what the college does. It sort of overlooks the training of psychiatrists in the UK, is to understand how we orientate ourselves to climate change and how we look to improve our offer of care for those struggling with mental illness. And I say that with all humility because I know that with as any institution, and particularly the professions, that we have lots of questions to answer about how we provide care and how to go about doing that, and to do that with humility and without hubris. And so I think what I can offer in the panel is that hearing Emma's amazing presentation, that there's a real question about how we provide mental health care and what is mental health in the first instance. Psychiatry does not have all the answers. I think where we do think we do, it's probably something to reflect on. I think what we do have is intention and increasingly an openness to understanding in terms of being able to reflect some key points, one of which is that human health is completely entangled with that of the environment. Psychiatry, I think, is amongst specialties such as GPs, public health, very understanding of the fact that how our human experience develops moment to moment is completely bound up with social determinants, and increasingly as we understand environmental determinants. And so I think that is going to be a paradigm shift in how we orientate ourselves as a healthcare service, and in the delivery of healthcare. I would very much be excited to see how climate cares can provide for that. It's about understanding human experience, understanding that these institutions don't have all the answers, and being open to people from all around the world to help feed back and help us see how we can provide better mental health care, whether that's about building communities, building relationships, or does it involve some degree of secondary service care, for example, the sort of profession that I lead or that I'm involved in. So what I can say as well is that, you know, our institution, the Royal College of Psychiatrists, has done a huge amount, and I was just reflecting, Emma, how we sort of touched base when we released our position statement to declare a climate and ecological emergency, and it's just amazing to see academia almost be step in step with clinical experience, and that, I mean, I just sort of watching that presentation, I'm completely blown away by the dizzying speed and the success that's happened in just an unbelievable amount of time. And it's been an absolute pleasure to find the opportunities to collaborate and where we can offer our clinical experience, and the kind of openness with collaboration that Climate Cares has shown as a program has been really humbling. And we just wish you all the greatest success, and to be able to, and we're basically on hand to be able to have any help that we can going forward.
Beautiful. Thank you very much. Thank you. But I want to, I mean, these are remarkable people, and Emma is a remarkable leader for us all. So I want to try to go one step further, and I'd like each panelist to share with the room what would make them really excited in 3 years' time if Climate Care Centre is doing something meaningful. The excitement that you hope will happen. And just to preface, I just want to remind everybody what Emma said. Climate change is not linear. It's an exponential phenomenon. It accelerates, and it's accelerating in ways that we don't fully understand. So for this centre to be exciting and make an extraordinary contribution, it's going to have to be very, very special. So I invite each panellist, when you're ready, to say, what would you feel would be an exciting contribution of this centre looking ahead 3 years? Who's going to have first go? You already started, so I'll come to you last so you can think again. What would make you excited? Are you ready, Omnia? Yeah. It's got to be something pretty special.
No pressure. No pressure.
Otherwise, I'll ask you to go again.
Yeah, I think there's so many things I'm so excited for when it comes to Climate Cares Centre. But if there's one thing I believe that we will be able to do is to really bring in the lived experience, the stories, the challenges, that we are seeing from the communities, from the people who are most affected, not just here but everywhere, because of the incredible network that we now have, the partners that we love and we work very closely with, and all of these incredible connections and beautiful relationships that we are building, bringing this together with the research that we are very much working very hard towards that, complementing it together and moving policies towards centering mental health of the people at the heart of climate change, but also vice versa, bringing in the climate impacts and how people are affected into the mental health policy as well as the political space, because now it's not just about commitments, it's about the health of the people, it's about our mental health, and this should be front and center of any policy that is being developed and any decision that is being made.
People's lived experience front and center, and not letting that be a side part, but the central part. Alan, are you ready?
I'm ready. So Wellcome is, of course, a funder of research, and therefore I will start with the formulaic response that we would love to see some really good research. But clearly, that's not where I'm going to stop, because that research has to do something. And I think what's clear is that the way you've set this up will enable the right sorts of research to be done. And for me, the key thing is that you will be able to deliver hope. Hope to those people who are frightened, and hope to those people who are suffering. Hope that there is a solution, hope that there is a way to support people through what is coming. You all know, you're all here because you know that the future is very, very bleak. And we need the sorts of work that you're going to deliver. And in 3 years' time, I'd love to see that.
People at the centre, hope being an absolutely major feature, and love has come in as well. So we've got lots of good emotions. Sacha, please.
I think at the beginning of the process with the Connecting Climate Minds project, I don't know if I saw her here, but Mala Rao said something that has stuck with me when we were discussing the purposes of research. And she stopped us and she said, for so long, research has been about scratching an intellectual itch rather than delivering truly impactful results for the people that the research is done on. And I think that that's one of the opportunities that I see with Climate Cares and the Climate Cares Center, is changing what research can actually do for people. I think research has asked a lot of questions in the past few years. Academia has said, how can we bring people into the bounds of academia who haven't been heard from before? But there's been very few questions about, why do those boundaries exist in the first place? Why are we the ones who have to champion someone else and lift them up, rather than going and meeting those needs where they're at and hearing those voices in their own words and in their own voices? So I think what I would love to see in 3 years' time is the Climate Care Center being a pioneer of that, as they've already been. They've championed members of this panel. I know personally I've always felt an incredible support in ways that I never had experienced in my life before from the people in the Climate Cares team. So I'd love to see a continuation of that in ways that are both big and small. And I think one of the ways that I see that really working well is across different stakeholder groups, bringing in, women, young people, everybody who has historically been excluded from these conversations, and then also fundamentally redistributing where the voice and the platform and the research is done globally, because we know we have a quite colonial problem in global health, and I think this is one of those opportunities to fundamentally address it and reverse it. And the final thing I'll add, because I'm surrounded by friends and colleagues, is in 3 years' time, I would love to see all of my collaborators happy and healthy. You guys work so hard, and there will be future collaborators that we work with. But if we're going to continue to work hard, then we need to take care of each other and ourselves.
People. People, hope, love, and real benefits, but at the same time, caring for ourselves. Jenny.
And first of all, thank you so much, Sacha. That was really sweet. I think in 3 years, what I would love to see, and of course, this is really ambitious, but, earlier speakers spoke to that, decolonizing work around climate change, mental health work. I think for too long, when we look at the root of climate change, how did we get here? It's oppression, it's extractivism, and it's kind of sharing and creating a power dynamic that makes people feel less than they are. And if climate cares can change that dynamic in research work, in policy, and in action, I think we'll be up, onto a really great start. To do something that ambitious, we obviously need spaces to reflect, spaces like this to come together, to think about how far we've come, what we've done, what the mistakes are. And I think we're on to a great start. To think more about how can we experiment, how can we try, can we be courageous enough to fail forward, learn what didn't work, document them, be bold enough. Someone said something earlier today at a discussion. She said, most times with conversations like this, there's a race to be the first. There's a race to do something. However, while we're trying to race, to be the first and to be so sort of power holders in these spaces, people are suffering and impact is not being made. So climate cares, this is such, it's an ambitious feat, but can we change the way we are used to working in these spaces where when research comes out about the Global South, it's actually Global South researchers that worked on it, and they're proud of their work. If we need training, let's work together, literally, saying that you haven't come to help us. You've come here because, literally, your pain, your suffering is bound to mine, and we're all learning together. So that is what I would love to see in 3 years' time.
People, hope, love, real benefits, and some power relations to change while we look after ourselves. But the changing power relations are about decolonizing and solidarity. Thank you, Jenny. Jacob.
So three things I can think of. One is that I think, as I'm sitting here, I think about injustice is a big question for a lot of us in terms of why things haven't changed quickly enough. And I would like to see Climate Cares be a platform to elevate stories to help address failures of imagination and empathy, I think, at a level of decision-making which is preventing the change that we need. And it seems that through your global network already, that's been astoundingly possible at a very short amount of time. So I guess creating a pathway between the work that you're doing to people who are making decisions on behalf of those more vulnerable and elevating those stories. Number two, I think this is something that beholds to all of us, but while you're creating a new center, thinking about, are there possible to support other parts of the world to develop similar centers as well, and to start creating a wider network, but 3 years isn't a very much amount of time, but thinking about already trying to share that knowledge that you've developed and establish other places. And then thirdly, we would be very grateful within mental health care if you could find the things that do work under these circumstances, and so that those of us who haven't been affected yet by climate change can learn from those who are, I guess, bearing the brunt at the moment. So a third point on care.
Jake, thank you, everybody. This has been a most brilliant panel because, as you probably felt, or at least I felt it, the conversation just grew and built. And so as well as seeing what is needed for people, seeing that this is about power, we've also had a real expression of humility and hope that this can spread and be part of a network that leads to genuine changes in the way in which health policy is developed and implemented. Does anybody want to make any comment from the audience? I could throw a microphone to you and you could just say what you like. Now's the moment. And there are many people here who've been involved. This is Philip.
So I just wanted to say, if in 3 years' time, this is such an emotional killer, I'm really sorry about this. If you could get in Britain the Treasury, who have a unit looking at the impacts of climate change, well, at least they did, I hope they still do, to acknowledge exactly what this is all about. Because there isn't a single government department that isn't going to be affected by this, and the British economy, et cetera, et cetera. And of course, it'll apply in other countries as well. And New Zealand has a treasury that owns an annual well-being report, where every department has to hand in measures of well-being, whether it's poverty or mental health or whatever. So I'm just highlighting that as a very challenging little goal, that we get a public acknowledgement from the Treasury that climate change and mental health are both incredibly important.
Thank you. You were nodding your head. Do you want to speak, Judith?
No, I chair an organisation called Climate Psychology Alliance, and Emma and I have conversations when we can. And I'm in absolute awe, really, of the work that you're doing and the ambition of it. And yeah, I think that's all that I want to say. Yeah, thank you.
Hi, I'm Simon. I work in the Grantham Institute. I'm going to answer the question, where could the centre be in 3 years' time? I'm communications manager. I know there's a communications manager in the IGHI. And we also work to get these topics recognised in the media. And my challenge to you, kind of mirroring Philip's challenge to you about the Treasury, is to get the media to take this seriously. I've just been sitting next to Sarah, and we've been comparing notes about how hard it is to get the media to take this as seriously as other causes of mental health, ill mental health. I speak to other people I work with in PR, and they say, well, climate change is a bad thing. Bad things cause bad mental health, so whatever. And I think that we can all work together to achieve that. I think people do excellent work. I remember listening to Jenny's podcast, for example, and being so impressed by the way that really conveys what is so meaningful about this topic. And journalists love people stories, and we're all talking about people stories. And that should be the challenge to us to go next.
Thank you, Simon. Glynis, please.
I just want to thank everybody for the contributions that they've made this evening. I think that Emma did us proud in representing what's been going on frenetically over the last 3 years. I really feel, sitting here this evening, I felt the significance of the increasing voice of youth, or people who aren't really young anymore, actually. You're grown-ups. But the real need for that voice of youth as part of the process of lived experience being understood more generally. Can I say, though, that we want that, but what we don't want, what I don't think we need, and what we shouldn't want, is to, in that process of raising the significance of young people, cause some sort of segmentation, a different fragmentation within those people who need our support. Because I think that older people also need our support. It'll be a different sort of understanding of the lived experience in different places across the world. But it is a very significant thing to try to incorporate, not to lose, when we are growing other voices. Do you see what I mean with this? And hearing you tonight, I've thought to myself, yes, I want to have some octogenarians in this room saying similar things about the power and significance of their voice too. So.
Anybody else like to make any comment? I'm going to go back to the panel, and then I'm going to go to Emma for a last word. So, yeah, sorry, ma'am.
I could make one small comment. I'm Megan. I'm coming from the Red Cross Climate Centre, and we've had the privilege of working with the Climate Cares team on connecting climate minds. And I have seen a slow progression over the months that many of our Red Cross network have been able to participate in the various dialogues that we've had with Connecting Climate Minds, and that slow evolution of understanding the mental health impacts on par with climate impacts from a disaster response perspective. And I think what I would like to see in 3 years' time is for us to just continue taking a lead from you, the Climate Cares team, in thinking about how we can integrate this into our humanitarian operations and really, as the first responders, be able to be at that operational level, not just in the distribution of items and sanitation and sort of so forth, but on that psychosocial support center, and bring our psychosocial support up to the same scale that we're able to do on more typical health impacts. So in 3 years, we're following you along, and we're trying to change hearts and minds within humanitarian operations. And I'm already seeing little steps, even though we've only been working together for less than a year so far. So that's where I'm looking forward to in 3 years.
So Mary at the back, please. Mary.
Yeah, I'll just be very brief. This has been quite an emotional event, David, and I think it's important to recognise that this is an emotional event. And I think the reason it is because we're hearing really authentic voices. And we've talked about hearing different types of voices and diversity of input. But the word authenticity is really important because people are bringing to this their true self, their true opinions. And I think in 3 years' time, I'd like to come to an event and still feel that. Because I think it's quite easy as these kind of activities gain traction, gain momentum, gain partners, that you can dilute that level of honesty and openness and authenticity. So I would like to come to an event in 3 years' time, feel like we've made massive progress, but still feel that true sense that everyone here is their authentic self and able to be their authentic self in the room, and that we are taking this, it's a sense of humanity really, with us on this journey, and we don't lose that core.
Thank you, Mary. A last word from, if any panellists would like, you've been listening to these comments. Do you want to say anything else, Omnia? No pressure. Or Alan? Sacha? Jenny?
I mean, I really... I'm always
say it
talking.
for all of us, come on.
No, I really like the comment about, fragmentization and the risks of that. And I think one thing I'm learning is that young people genuinely care about how do we get it right, basically. So in my work, 7 years, SustyVibes, working with young people, we're thinking of farmers, we're thinking of our parents, we're thinking of churches, mosques, we're thinking, how do we get everybody to think the way we do, to be really passionate about protecting the environment and our well-being? And I think it's really good. One of the projects that we're doing now that spilled off from this conversation is something we call Climate Elders, where we're working with elders in Nigeria, age 55 and above, and we're talking to them about climate distress and resilience. So you see, it's literally from young people saying, well, there's so much we can learn from our grandparents and our parents about resilience. So I think it was really good that you mentioned that. It's something that's really important to us.
That's cool. Just before we finish, and I would pass to Emma, I want to pay credit to Peter Howitt, who's sat at the back there quietly, who's very much holding things together. I also want to respect Ara Darzi, who's co-director of our Institute for Global Health Innovation, who originally provided the stable where Emma and team grew the Climate Cares initiative before I was around. He couldn't be here tonight because of a clinical emergency, and I'd just like, on his behalf, to thank everybody for being here. And now to Emma.
Thanks, everyone. I mean, it feels like a lot to follow what has been, as we've heard, really authentic, really emotive, really, really powerful voices. And I guess you can see why I love my job, because I get to work with people like this day in, day out. And it's a true privilege, and I think that can be overused, but I think you all can see tonight why that's the case. And we're ultimately trying to do this in service to those who are living these impacts around the world. But not only doing that in service, but doing that with them and raising up their voices, their challenges, but also their solutions. I just wanted to touch very briefly on a few of the points that around the room. I want to thank all of the kind words and comments. I just wanted to note on the power of story and the power of feeling. So I'm a physicist originally by training, and then a computational clinical neuroscientist. I think it goes without saying I like evidence, I like data, and that is super important. But what we've heard also when we did a workshop with the Met Office scientists is the importance of allowing people to feel. Some of the respondents, on the Mentimeter when we were doing in the workshop, of what they took away we're like, it's okay to feel things in your work as a scientist holding this space. And that's what we've seen a lot, is the paradox in this work and in the climate crisis of having to hold hope and despair simultaneously, having to hold space for people to grieve, for people to be angry, at the same time as we use hope as a verb, as Sacha often says, and work towards that future we want to see. And Brian Eno gave a wonderful keynote with Grantham last year and talked about the power, as Simon says, of the creative industries, of the fact that we have to join together and ensure that people not only have the stick and what is going wrong, but also that vision, that imagination of that better future and the world that we're fighting for, what we love, what we cherish, what's important to us. And that really comes back to things like our mental health and well-being, the health of ourselves, our families, our communities. And I think there's great power in joining together, whether it's across the humanities and science, whether it's across allowing people to be both humans and researchers. You know, these are things that shouldn't be siloed. Neither should the way that we think about our climate and what it is as humans that we're trying to save, which is really our own mental health and well-being. So it's just and just to one final thing is that, you know, as someone who has my own lived experiences of severe mental illness, when I was back in the day a young person, you know, one of the biggest things was wanting to be seen still as myself and just still as that, or, you know, that you are a person and seeing that humanity. And so that's something that people want within mental health, and is one of the biggest things that helped was just feeling accepted, feeling loved. And that's the same thing that people want within the climate crisis, is to be seen, to be heard, and to be supported, and to be enabled to enact the solutions that often they already know best for their own communities. So really that's what we're trying to do, is just connection, whether it's across climate and mental health, whether it's across the silos that we know exist within funding, as you said so eloquently, Phil, of the problems of seeing the challenges of our world atomized. And it just comes back to seeing this as a holistic, interconnected challenge that means that there is a compounding risk, but also a compounding opportunity. And so, yeah, just thank you so much for joining with us to turn the ship towards that opportunity as much as we all can. And we know we can't do it all, but we can always be pushing towards that better future. Wherever we are, there's always a better and a worse path forward. So let's be on the better path. Thanks, everyone.